Hello, thank you for coming and taking part in this video. Can you introduce yourself please and give me some outline of your experience?
Okay, my name is Dr. Thiti, I'm the plastic surgeon. I'm graduated from plastic surgeon for roughly around 15 years already. Right now, actually, most of my cases is sex reassignment surgeries and other plastic surgery that associated with this kind of surgeries. For the sex reassignment surgeries, I've done, actually it's more than 500 cases right now. The average is roughly around 20 cases a month right now. Mm-hmm.
Okay.
It's definitely included for the sex reassignment surgery,
Right.
not included for other kind of surgeries.
Okay. So can you explain the procedure you perform?
Yep. Normally, I perform male to female sex reassignment surgeries. I have expertise in that. If they have some case of female to males, I might use my colleague to handle that cases. For
Right.
that.
So is your procedure known as penile inversion?
Yes, normally I love to do the penile inversions and also the colon vaginoplasty. But for the generally the skin, normally I love to use the penile skin inversion plus skin graft, because almost every patient that the penile skin is not enough to use, so I need to plus the skin graft to make more depth.
Okay.
Mm-hmm.
So can you give me a difference? There's obviously a difference between penile inversion and non-penile inversion.
Yep.
What are the advantages and disadvantages of going that way?
Because actually the term of that some surgeons use for non-penile skin inversion is mean the inside of the vaginal cavity is totally grafted. The graft is actually at first it's non-viable tissues. That means it's a dead skin. And then we know that if we place the skin to stick around the places for a while, like 5 to 7 days, then the blood vessels start be growing inside the skin and it rebirths again. But when it rebirths, the quality was changing. The skin graft actually is trying to shrink down. So it can contract it and the vagina might be a little bit shorter. So they need to use the dilator to combat the strength of the contractions.
Okay.
The difference is although I use the penile skin inversion, I still need to use the skin graft to get it more deeper. But the advantage of the penile skin inversion is it's a viable tissue, so they have some elasticity.
Okay, I understand. Yeah.
So it might be better and easier to put it inside.
Yes. So, how long on average would a penile inversion SRS
Roughly
operation
around
take?
3 to 4 hours.
3 to 4 hours.
Yes.
Oh, that's not long. And how long can the patients expect to stay in Bangkok post-surgery?
Normally, our patients stay in the hospital for around 5 days, and they need to remove the stitches and try to dilate first, roughly around 1 week after surgeries. After that, because of there might be some swelling, there might be a little discomfort after surgery. There might be a little bit discomfort when they pee. So normally I recommend that they should stay in Bangkok until all the recovery is getting better. That's supposed to be roughly around 2 to 3 weeks after surgery.
Okay, thank you very much. And how long after surgery would patients expect to wait for such things, normal activities such as lifting, and obviously the big question everyone asks is sex?
Okay, so actually if you use skin graft, either non-penile skin inversion or penile skin inversions, if you use skin graft, the skin graft will stick adhere with the vagina strongly after 3 or 4 weeks. So normally I recommend that after surgery, roughly around 4 to 6 weeks to get normal activities for the vaginas. But for the other activities like swimming or running or heavy exercise, actually it depends on if the wound is, everything is perfect, no wound disruption, after a month, they can go for that.